This is Chester. This is one of the little kittens that was on the ChipIn. We're trying to raise money to pay for his surgery that he's already had. As you can see, he's very energetic. He's healing quite well. He has no problems really getting around. Well, I want to show them your leg, silly. Oh, yeah, there you go. You can kind of see it. Come here. Come over here. Chester. You can see he's a typical kitten, very energetic. He really wants out of his cage, and hopefully he'll be able to get out soon. He has to go back in for surgery to have the pin removed when it's ready. I think they said maybe a month or so. So that will be some additional cost. Hopefully we will be able to have the money to pay for all that before we have to worry about it. So this is Mr. Chester. All right, you gotta get back in the cage. Come here. All right, let's go see Barnabas. Let's go see Barnabas. Hold on. Oh, I know, you're very mad at me. Yes. I'll come play with you later. Let's go see Barnabas. Oh. This is Barnabas. He was the cat that was shot with the .22. He had his front leg amputated because it was shattered. He actually had the scapula removed too because it was so bad. And you can see that he has the traumatic injuries to his eyes. We're not sure exactly how he got those, but the vet says probably some sort of blunt force trauma. They're actually scratches on his cornea. They're not cataracts per se, but they are basically rendering him pretty blind. They're estimating he'll probably be completely blind here pretty soon. There's not really anything we can do to stop it, sadly, but he's a very sweet cat. Isn't that right, Barnabas? Yes. He does have some vision right now, but if you're not careful when you go into his cage and you make fast movements, he actually gets startled and he'll hiss at you. And that's about it. He doesn't get aggressive or anything. He's just, you have to be patient with him and cautious when you enter his cage because he doesn't like to be startled. You can see that was his leg amputation site there. Lay back down. Come here. You can see it a little bit better now. As you can see, it's nice and healed and the fur is all grown back. He did have a surgery a while ago because he was in considerable pain and we didn't want to wait, so he's also on the ChipIn that we're trying to raise money. So, and then I'll show you Biscuit here in a second. Yeah, he's a good boy. Alright, let's go see Biscuit. And this is sweet little Biscuit, who has the broken zygomatic arch on her face, which we are guessing was done by somebody kicking or hitting her, because she didn't have any other injuries anywhere else, so she wasn't hit by a car. And according to our vet, it's very difficult to break the specific place where it is broken, so it's a pretty fair assumption to say that somebody did something not very nice to her. Hold on, let me see if I can get her to come out. Come here, Biscuit. Come here. Come here, sweetie. Come on. There we go. She's relatively young. I think the estimated age is probably 6 months or so, so she's not terribly old. But you can kind of see how her face is shaped a little bit differently on the one side. She's very nice. She's very cute. And very playful, yeah. She's probably going to have that removed, the eye removed, probably in about a month. But we have to wait because she has a big pocket of infection in her bone of her skull. So they don't want to do the surgery until we clear that up. So she's on antibiotics for that. And then they'll do some more x-rays and see if it looks like it might be cleared up. And then we'll go from there. So these are the 3 that are on our ChipIn right now that we're trying to raise money for. I figured maybe a video would be an easier way for you to kind of get an idea of what we're looking at here, because pictures can only tell so much. Alright, thank you.